Right now, as you're watching this, your legs and feet may be trying to get your attention, not in a dramatic way, not with a big headline symptom, more like quiet signals that many people explain away as just getting older, being on my feet, or my shoes are tight. In the United States, millions of people are living with ongoing heart-related circulation problems, and a surprising number of them first notice something unusual in their ankles, calves, toes, or feet, long before they connected it to their overall circulation. That's why this matters. Here's the part most people don't expect. When circulation from the heart is struggling, the earliest clues are often not what you see in movies. Instead, the first hints can show up in places you're used to ignoring, especially in your lower body. So let me ask you something. Have you ever blamed ankle swelling on a long day, a salty dinner, or new shoes? Have you ever felt your feet go cold or numb and thought, bad circulation, I guess? If any of that sounds familiar, stay with me. And if you care about practical, calm, real-world health guidance for the years ahead, subscribe and turn on notifications. This channel is about noticing the small signals early so you can take sensible action. And to help me understand who I'm speaking to today, type 1 in the comments if this topic feels relevant to you. If it doesn't, type 0. Your comment helps this message reach the people who need it. Today I'm going to walk you through 12 signs that can show up in your legs and feet when circulation from the heart is under strain. These signs can have other causes too, so I'm not here to diagnose you through a screen. I'm here to help you notice patterns, ask better questions, and know when it's time to get checked. Also, please stay until near the end, because one of the most overlooked signs tends to appear at night, and many people never connect it to what's happening with fluid and circulation during the day. Let's start with the first sign. The first sign is feet that are consistently cold. Most people treat cold feet like a personality trait. That's just me. Or they assume they need thicker socks. But when circulation is struggling, the body makes choices. It prioritizes blood flow to your most essential organs first. That means the areas farthest from the center, like your feet, can get less consistent circulation. Now here's what separates everyday cold feet from a more concerning pattern. Everyday cold feet usually warm up when you move around, when you're under a blanket, or when you're in a warm room. The more concerning pattern is when your feet stay cool no matter what you do. You can be indoors, comfortable, wearing warm socks, and your feet still feel like they never truly warm up. If that describes you, it doesn't automatically mean something serious is happening. But it is a reason to pay attention, especially if cold feet show up alongside other signs we're about to discuss. The second sign is a simple finger press test on swelling, often called pitting swelling. If you have swelling in your ankle, lower leg, or top of the foot, you can try this. Press your finger firmly into the swollen area for about 10 seconds, then let go. If you see a dent that stays for several seconds before slowly filling back in, that's a specific kind of fluid buildup. Swelling after a long day on your feet can happen. But pitting swelling can suggest that fluid is collecting in the tissues rather than just a temporary puffiness. One of the common reasons fluid collects in the lower body is that blood returning to the heart is meeting resistance, and pressure increases in the veins. When pressure rises, fluid can shift out of blood vessels into surrounding tissue, especially in the legs and ankles where gravity pulls it down. Again, this can have multiple causes, but if you notice pitting swelling regularly, or if it's getting worse over time, that's a solid reason to talk to a healthcare professional and describe exactly what you're seeing. The third sign is leg weakness that feels out of proportion. Not normal tiredness after a busy day. I mean the kind of weakness where something that used to be easy suddenly feels harder. Stairs feel heavier. A short walk makes your legs feel shaky. You might even say, "My legs feel like jelly," and you can't quite explain why. Your leg muscles are large, hard-working muscles. They need a steady delivery of oxygen and nutrients to perform well. When circulation is not meeting demand, legs often complain early. You may notice reduced stamina, earlier fatigue, and slower recovery after activity. And sometimes people mistake this for, "I'm just out of shape." when really it's a signal worth checking, especially if it's a noticeable change from your normal baseline. The fourth sign is rapid weight gain that seems to happen quickly, especially when it comes with swelling in your lower body. If the scale jumps up by several pounds in a short time and your legs and ankles also look puffier, that can be a clue that your body is holding on to fluid. Fluid can add weight fast, and it tends to settle in the lower body. This is one reason many clinicians tell people to track weight trends, not just for fitness, but for noticing unusual changes. If you notice a sudden, unexplained jump on the scale paired with swelling, that's not something to wait out for weeks. It's something to bring up promptly. The fifth sign is a bluish-grayish or dusky color in the feet or lower legs. This is one of the most visually obvious signals, and it's not cosmetic. When blood isn't carrying oxygen as efficiently to tissues, or when blood flow is sluggish and pooling, color can change. Often it shows up first in the toes, feet, and ankles. Sometimes people only notice it after sitting for a long time, or when standing for long periods. If you look down and think, that color doesn't look like me, take it seriously. It may be related to circulation, temperature, veins, lungs, or other issues. Either way, it's worth being evaluated. The sixth sign is ankle swelling that follows a pattern, mild in the morning, worse by evening, and repeating day after day. A little swelling after a long day can happen. But the pattern I'm talking about is more consistent. You wake up and your ankles look almost normal. By the end of the day, they look puffy, feel tight, and your socks leave deeper marks than they used to. Your shoes may feel snug by afternoon, even if they fit fine in the morning. This kind of day-to-day progression can suggest fluid accumulating under the influence of gravity, and it can be connected to how well the heart and veins are moving fluid back upward through the body. If you also notice that elevating your legs doesn't improve things much, or it keeps worsening over time, that's another reason to get checked. The seventh sign is slow healing of cuts, scrapes, or sores on the legs or feet. Here's the practical reason this matters. Healing is an energy-intensive process. It needs oxygen, nutrients, and immune support delivered through good circulation. If you get a small wound on your lower leg or foot and it lingers far longer than it used to, that can be a sign that circulation isn't delivering what your tissues need. Sometimes people dismiss this as, "My skin is older." And yes, healing can slow with age, but there's a difference between a little slower, and this is lingering week after week with very little improvement. If a wound is not improving, or if you're seeing redness, warmth, drainage, or increasing pain, don't self-manage it indefinitely. Get it evaluated. Foot and leg wounds deserve careful attention. The eighth sign is cramping or pain in the legs when walking, which improves when you stop and rest. Some people describe this as aching calves. Others describe it as tightness, heaviness, or cramping that forces them to pause. It may start with longer walks, then gradually show up after shorter and shorter activity. When muscles don't receive enough oxygen-rich blood during activity, they can protest quickly. And because the leg muscles are so large and active, they can be among the first places you notice a circulation problem during movement. If you've started avoiding walks because your legs cramp too quickly, that's not something to just accept as, "That's aging." It's something to bring up because it affects mobility, independence, and safety. Now we're at the ninth sign, and this one tends to show up at night. Restless legs at night, especially when it's new or worsening. You finally lie down, ready for rest, and then your legs won't settle. You feel a crawling sensation, tingling, twitching, or an intense urge to move. You change positions, stretch, walk around, and it keeps coming back. Here's one possible reason this can connect to circulation and fluid patterns. During the day, gravity encourages fluid to settle in the lower legs when circulation is sluggish. At night, when you lie down, that fluid can redistribute back toward the center of the body. That shift can affect nerves, pressure, and sensations in the legs, especially in people who already have swelling during the day. Restless legs can have many causes. iron levels, medications, nerve issues, caffeine, sleep quality, and more. But if your restless legs started around the same time as swelling, shortness of breath with exertion, unusual fatigue, or a sudden change in your lower body symptoms, it's worth mentioning as part of the whole picture. The 10th sign is varicose veins that suddenly get worse, or new varicose veins appearing quickly. Many people have varicose veins for years, and they change slowly. The pattern to watch for is rapid change. Veins that used to be mild become larger, more uncomfortable, more numerous, or more prominent over a short period. Leg veins have one-way valves that help push blood back upward. If those valves weaken, blood can pool. If overall pressure in the venous system increases, the veins can become more stressed, and visible changes may accelerate. Varicose veins alone do not confirm a heart problem. But a sudden, meaningful change is a signal that something in the circulation system may be shifting, and it deserves a professional evaluation. The 11th sign is skin changes on the lower legs and feet that look and feel different. Take a look in good light. Does the skin look shiny, stretched, unusually smooth, or almost glossy? Does it seem thinner or more fragile than it used to? Does it feel tight, like the skin is under tension? When fluid builds up in tissues, it doesn't only create visible swelling. Over time, it can change the structure of the skin. The natural texture can flatten, pores and tiny wrinkles can smooth out, and the surface can reflect light differently. Sometimes the skin becomes more delicate and easier to injure. If you notice these changes along with swelling, it's an important clue that the fluid issue is not just occasional puffiness. And now the 12th sign is numbness, or tingling in the feet that becomes more frequent or persistent. Most of us have had a foot fall asleep once in a while. The more concerning pattern is when numbness or tingling becomes a regular visitor. It shows up during the day. It affects balance. It makes walking feel less secure. There are two practical reasons this can happen when swelling and circulation are involved. First, swelling can compress small nerves in the feet and lower legs, changing sensation. Second, nerves, like every tissue in your body, depend on oxygen. If oxygen delivery is reduced, nerves can start sending confusing messages, pins and needles, burning, tingling, or numbness. And there's another reason this matters, especially for older adults. If your feet are numb, you may not feel a blister, a pressure spot, or an injury. That can lead to a small problem becoming a bigger problem simply because you didn't notice it early. So let's take a breath and zoom out. We just walked through 12 signs that can show up in the legs and feet when the body is dealing with circulation strain. None of these signs is meant to scare you. They are meant to inform you. They are meant to help you notice patterns earlier, rather than months later. Now, I want to speak to you the way a wise older friend might. If you're in your 60s, 70s, 80s, or beyond, you've learned that the body doesn't always shout. Sometimes it whispers. Sometimes it repeats the same small message every day until you finally listen. And the legs and feet are often where those whispers show up first. Cold feet that don't warm up like they used to. Swelling that leaves an imprint. A scale that jumps up quickly. Calves that cramp on short walks, skin that looks stretched and shiny, restless legs that keep you from sleeping, numbness that affects your balance. If you recognized one sign, that's worth noting. If you recognize several signs together, especially if they are new, worsening, or happening as a pattern, that's when I strongly recommend you talk with a healthcare professional and describe what you're noticing. Not in a vague way, in a specific way. Tell them when it started. Tell them what time of day it's worse. Tell them whether elevation helps. Tell them about shortness of breath during activity, unusual fatigue, sleep disruption, or any other changes you've noticed. The clearer your description, the easier it is for them to connect the dots. And please remember this, early attention tends to give you more options, not fewer. When you act earlier, the conversation is often about manageable steps, practical monitoring, lifestyle choices, and targeted treatment if needed. When you act later, everything becomes more complicated. So if your body is sending consistent signals, don't wait for a perfect time. Take the next sensible step. Now I'd like to hear from you. Which of these signs surprised you the most? Was it the pitting swelling test, the nighttime restless legs connection, the shiny stretched skin, or the sudden leg weakness? Write it in the comments. Your experience may help someone else notice what they've been ignoring. If this video helped you understand your body a little better, please hit like. It helps the channel reach more people who want calm, useful health guidance. Subscribe if you want more videos like this, and turn on the bell so you don't miss the next one. And one last reminder, said with care, this is educational information, not a personal diagnosis. If something you notice today feels persistent, new, or worrying, it's wise to get it checked. Your future self will thank you for being the kind of person who pays attention early. Your legs and feet are not just carrying you through your day. Sometimes they're also delivering messages. If you're willing to listen, you can take smart action and protect your health for the years ahead.